Hi, good morning. My name is Paul Grid. I'm part of the insurance committee, and we just have a few slides to talk about because. Yep. Oh, sorry about that. Haven't done this before for this group. Anyhow, on September 12th, we did a webinar. We usually do one every September. They have been seminar webinars in the past, but this year was just virtual. And we covered the things that we usually cover, kind of a basic overview of Social Security, a Medicare overview, Medicare Advantage versus Gap. And then there's some with detailed presentations on Medicare Part D and Medicare Advantage versus Gap. And as usual, all of those presentations are on the website. The actual videos from the webinar are on the website. So if you want to go look at them, and you can go through the whole thing just as if you had watched it live. So Medicare highlights. As you probably know, because you've been inundated by stuff on TV and radio, the open enrollment for Medicare started Tuesday and runs till December 7th. And during that period, you are free to change Medicare Advantage plans. You can change Medicare Part D plans. And Part D is something you want to look at every year anyway, because you can change that plan every year without any penalties. Let's see here. Not my slides. So I guess one of the key points to be aware of is, there's a lot of changes going on in the industry, in the insurance industry. If by some chance you're in a Medicare Advantage plan and the company that sponsors that plan either goes bankrupt, goes out of business, or decides they're not going to offer Medicare Advantage plans anymore, it gives you an opportunity that you normally wouldn't have, which is you can now go and select another Medicare Advantage plan, but you can also select a Medigap plan with guaranteed issue. And just to remind everybody, what that means is when you first go on Medicare, you have what's called guaranteed issue. So no matter what kind of pre-existing conditions you have, you can sign up for a Medigap plan and they have to accept you. After the first year, like for myself, if I wanted to change Medigap plans this year, I would be subject to medical underwriting, which means if I have any significant pre-existing conditions, the new company might not want to accept me. But as I said, if you're in an Advantage plan and it goes out of business or it's not offering your plan, you get this guaranteed issue opportunity, which is a really nice feature. Okay, there's some significant changes to Part D this year. As I said, usually every year you want to review your Part D anyway. That's your prescription drugs, because you can change plans every year without any penalties or anything like that. And there's a really good government website that you can compare. Your drugs may change. Some of your drugs that were covered may not be covered. The other thing is that we anticipated in the insurance committee that the cost of the Medicare Part D was probably going to go up because well, on one side, the deductible went from $545 to $590. That doesn't apply to tier 1 and tier 2 generics, but it applies to everything else. But the biggie here is for 2025, they've changed the phases of Part D. And this is a really significant change. It's something they've been working on in Congress for quite a few years. There's a $2,000 max out-of-pocket limit on what you have to pay for drugs in 2025. Now, what that means is if you unfortunately have some real serious medical issues where you're taking some very expensive drugs, once you have paid $2,000 for drugs in 2025, for the rest of the year, the drugs are free. So we looked at that and we said, well, that's good news. But if the Medicare Part D companies are going to do that, they're going to want to get money from somewhere. So we anticipated that the premiums for all the Part D plans were going to go up. Well, we got a very pleasant surprise. I got my notices of change for 2025. My plan, which was 0 premium for 24, is 0 for 25. My wife's plan, which was with Cigna, was about $15 a month in 24. In 25, it's 41 cents. Why they came up with 41 cents, I don't know. The paperwork costs more than that. But anyway, so it looks like the good news is that the Part D premiums are not going to go up, but you still want to double check. Like I say, go to Medicare.gov. There's a really great document on our website that gives you real details and how to review your Part D, because the drugs you take may change, the drugs they cover may change, the prices of drugs may change, and since you can change plans with no penalty, there's no reason not to review that every year. They came up with one other item, even though there's a $2,000 limit. Let's say you have some very expensive drug and the first time you go to get it, it's $500 and it's under the deductible, so you got to pay the $500. They've come up with a no-cost monthly payment plan. So if the $500 is going to blow your budget for the month, you can spread that out over multiple months through the government, no charge, no interest rate. So that helps you manage your budget if you're a little tight on those funds. The other thing is to try to help everybody out. If you're having some trouble, want some help with, well, what plan should I pick? Should I change plans or whatever? There are several sources of help, again, at no cost to you. The first sources, there are trained volunteers, and all this information's on the website. You don't have to take notes. There are trained volunteers in this state and other states who you can call up and talk to, and they will help you. There are professional insurance agents. These are businesses, but there are 3 that we have worked with for years in the insurance committee, and we've gotten very positive feedback. These are really good people. They'll give you the straight poop, and they can help you if you want to change plans or just review the plans you've got. And you can see the 3 of them: Butler Capital, Double Health, and Laura Camacho. Again, all this information's on the website, and there's some nice one-pagers showing you their pitch. There's also 2 companies that FCA recommends, Via Benefits and Amwins. I was just doing a little research on my phone. Amwins is a private insurance company that puts together group policies. So they've got a special group policy. It's only available to people who are Chrysler retirees, and it has some unique features and some unique premiums. To be honest with you, I'm not really that familiar with the details, but if you want to look at it, these are their numbers. And like we said before, even though we're open for questions, as Mike said, why don't we hold those until the end? I think that's it. Thank you.